Live on Facebook.
We actually live?
Yeah, it says we're live on Facebook. You should know, Mr. Technical.
Oh, excellent. Good.
Are we live?
I think we're live.
Right.
If you just joined us, we are actually live on Facebook. So really nice to see you all. Massive technical problems tonight. I don't know what's going on at my house. Maybe the kids have been playing with the computer or something without me knowing. But apologies for the delay. Better late than never, hey? So Rupert, what's been happening?
What's been happening? I've been waiting for an hour. Before that, I've been sitting down all day because I think, as you might have titled this video, I've suffered quite a serious injury.
Rupert said himself.
It was quite a serious injury in my eyes. You know, it's led to me having to be fed and lie on the sofa all day. So I've sold it as a serious injury. It's actually probably just a light.
You cut your hair again?
The strain, huh?
You cut your hair again?
Yeah, well, we've got some clippers. Last time was a wet shave. I found some clippers in boots, St Albans boots, if anyone needs clippers. They had loads of pairs. So I was actually going to start selling them, rebranding them with kitbag stuff and get them going online. But yeah, get down to the boots in St Albans, £20 a pop, and it will fix what you guys saw last week. So not too bad from Mrs. Kitbag, who's upstairs at the moment. Very happy with herself for this. So
does she know she's a Mrs. yet?
No, she doesn't. But I've been kicked downstairs. I always get kicked out. So she goes, "What is it? That 8 o'clock thing with Steve again?" She says, "No, surely no one actually watches that, right?" I said, "Well, it's at 9 o'clock tonight, isn't it?" I'm still waiting for him. It's going to be at 9 o'clock, so maybe people will tune in. Who knows?
Excellent, good stuff. So Rupert's hurt himself. So tonight we're going to be talking about tennis-related injuries and what to do about them if you do get them. Also, we're going to be talking about why you get tennis-related injuries as well, which is probably quite relevant for Rupert right now because, as you know, we're in isolation. So Rupert isn't playing tennis at the moment. So what have you been doing, Rupert?
Literally nothing. So it's the first time. So I'm on court 7 days a week. I know.
Yeah.
I would say I'll work hard, but I was waiting for you to tell me that. But
no, I think you work really hard. I think you work very hard at doing your tennis coaching. But
I work hard. I'm on court all the time. It's quite a hard life, really. But yeah, no. So my body's always on the go, and then it's got used to, I guess, just sitting still. So I went to take my one exercise session of the day yesterday, and it all just went horribly wrong. So, yeah, terrible.
One exercise session a day. So tell us what happened.
What happened? So I was about to kick a small miniature football at a park. I won't disclose the location in case I choose to go there again. People come out to laugh at me kicking a football. And what happened when I kicked this football is my left leg, which I just planted on the ground. This is great listening, isn't it? And watching. My left leg decided to go ping between my knee and my hip. So in the front. So my quadricep, I think, as Steve will confirm.
Yep, that is your quadricep, Rupert.
That's the culprit.
That is the culprit.
So yeah, that's what happened. Sat down for a bit. But yeah, carnage really. What can I say? Painful.
Excellent. Right, so Rupert didn't want to get his legs out tonight, so we came up with this.
What legs did you say?
What legs, exactly.
So we've actually done a 3D scan of my body.
Let's see if we can get it to go live.
And there's the 3D scan.
Excellent. So that is Rupert 3D scan.
We've actually taken some weight off those legs there.
Excellent. So this is we've been doing lots of online consultations actually with clients, and this is something we'd probably go through with clients to get a good understanding of their injury. So what we'd be looking at with someone like Rupert is injuries related to the front of the side. So we'd go through and we'd ask him questions about what he was doing, what it felt like. So that's quite a good indicator of kind of where the problem was and how it kind of presented. And get a real good idea of kind of the history. The history is really important because it gives us a massive clue with regards to a lot of what's going on with him. So we all know Rupert plays tennis. We all know Rupert isn't playing tennis at the moment. And we all know Rupert isn't probably stretching, and he probably isn't going out. Are you stretching?
Well, so I must come true. I must contradict my claims of Monday gone, where I did claim I was in a rigorous yoga routine. Might have slipped this last week, and look what it's led to, people. So what we spoke about that Monday.
Have you been doing yoga then?
Up until last Monday, of course, because that's what I told the people. So yeah,
have you been doing it?
I have, but I genuinely haven't this last week. It's been hectic. The weather was so nice. I was going out running. I didn't want to put my body through too much.
Yeah.
This rigorous hour a day of exercise compared to the normal 12 hours on court. And I didn't want to push it too much. So I thought I'll take a break from yoga. I've ordered my new running shoes as well. This is the worst thing. So they're not going to get to be used, are they? Because this is a pretty serious injury, Steve. I'm not going to lie. It's going to be a few months out, I think.
So this is the muscle that we think Rupert's damaged, but we've just talking to him because obviously we're in isolation at the moment. We haven't had a look at his leg, and this isn't his real leg. It's a little app that we use to help show patients what's going on with their leg. But it's for us, it's really important the patient really has a good understanding of what's going on with them, a real good understanding with regards to like how the mechanism of their injury might have happened. So if Rupert was playing tennis, we'd want to understand a little bit more about what he was doing when he actually felt the problem. So Rupert, with your leg, were you pushing off the ground? Were you running? What were you doing?
Genuinely, it would have been hilarious to watch. I'm not even dulling it down. I stepped my left foot next to the football. I was walking, I wasn't running. Bought this little sponge football from Pals, right? I stepped my left leg next to the ball to then kick with my right leg because I'm right-footed. I think it was about the time I kicked the ball, the muscle just went, pinged in my left leg. It was incredible. I was standing there. Absolutely baffling. I know there's a lot of weight to carry, especially with these branded T-shirts we wear. There's a lot of weight up there to carry on that leg. But
the left leg planted on the ground, so it's the opposite leg on the left-hand side, and the right leg was kicking the ball.
Correct. And at that moment, the left leg.
When did you feel the pinging sound or sensation?
I remember seeing the ball soar into, the imaginary top corner, of course. But as that happened,
when your leg was coming back, was it? This is the problem with patients is that you ask him a question and he's completely gone off on complete tangent because he wants. What do you want to say, Rupert? Come on, say it. What do you want to say?
I put my leg on the floor. I kicked a ball, and the leg that wasn't kicking the ball literally ping. At that time, really hot straight away, which was funny.
Yeah,
I've done my ligaments in my ankle loads of times.
Okay, so which ankle was that?
I've fallen off a motorbike. I've rolled it playing tennis. I've done it about 6 times. So I know what that feels like. This didn't feel like that. It wasn't as painful because that was terribly painful, the ligaments. But it just felt, it went very, very warm, very, very quickly. But it was almost like the pain grew. So it started just in the middle of the leg. So halfway between the knee and like the hip flexor. Yeah. And then it sort of spread out both ways from the middle at the same time. It was incredible.
Yeah. Yeah, very interesting.
I got on with it, and I actually didn't mention it to the person I was with. I just didn't mention
it. Apart from when they had to pick you up off the floor because you hurt your leg.
Yeah, bring me some tissues.
Yeah. Yeah, so that kind of rec fem area. So from the way Rupert's describing it, though, because it's he was able to walk on it afterwards, he's able to put a bit of pressure on it. So we probably wouldn't be thinking, and the fact that it's spread out made me think that it's probably more of what we call a fascial tear. So it's probably more the soft tissues and things around the muscles rather than the actual muscle itself that are to blame there. So we kind of just want to watch out for that in terms of the history. What we then go through next is ask Rupert to do some exercises to activate the muscles, so to get the muscle working, and then through understanding how it changes when he uses the muscle, when he squats, when he lunges, when he stretches the muscle, that will help us give us a big clue with regards to where the problem's coming from, whether it's the muscle, the nerves around the area, or the soft tissues around the area as well. Those are the main likely three things that could be causing a problem there. So that's kind of what we do. And then we'd go through and we'd have a look at some of the movements with regards to, so we'd ask him to lift his leg up. So this is basically what happens when he lifts his leg up. So we've got a combination of the hip flexor muscle. So this is the hip flexor muscle here. This is a psoas major muscle. And then you've got another muscle in here called the iliacus muscle. So they would be called your hip flexor muscles. But what was interesting with Rupert that you mentioned in the history there is that was if this would be fine if it was his kicking leg and he went to kick the ball. But the issue was that he had a problem when he was standing on the left leg, which might give you a little bit of a difference of opinion with regards to the mechanism of injury, so how he injured himself. So we just want to watch out for that with regards to the case history as well. But the main muscle he's going to be using in that particular activity, if it was the right leg, would be the rec fem. But as it's not the right leg, it's unlikely to be the rec fem that was causing a problem. But we still wouldn't want to rule that out until we'd examined him as well. So when we do clinical case histories with patients in clinic, no matter what sport they come from, it's always good to start from really having an understanding of the anatomy and physiology, what's happening with their body, how their body's working normally, then have a think about how the foot and the body has adapted to the forces that have gone onto it, and then examine it, and then have a look at how it would respond to initial treatment as well. So we'd want to have a look at the other muscles around the area as well, with regards to how his hip was rotating in particular. So this is a muscle called TFL at the top of his hip here, which is really important to help stabilize his leg. And you can see that if that was his left leg, that would probably be going through a very similar movement there, where his leg was being planted on the ground. His body would be moving around it rather than his leg moving. So it would be the opposite way around, where his foot's stuck still. So his foot would be in the same position. And his body would be kind of rotating over the top of that, which is something that's likely to happen with that. Now, the interesting thing about the TFL muscle at the top of the hip, just in here, is it attaches to a very thick band on the side of the leg that's just here called the iliotibial band. So a lot of runners get problems with that. And one of the reasons that runners get problems with it is because it's a very big fascial attachment. And in real life, it doesn't look exactly like that, because you have a lot of muscular compartments in the leg. And this is basically where all those muscular compartments kind of come together and form this very expansive thickening on the side of the leg. So it helps as basically a conduit to help mechanical force be transmitted through the leg. So when we have a look at Rupert's leg, we'd probably have a look at that area and examine it, see what's going on, whether it's tight, whether the muscle at the top of the hip is tight. So this muscle up here, so that kind of fascial area up there, and in particular that little red muscle underneath all of that called the TFL. We'd also probably have a look at these muscles at the back of the hip, they're glute medius and glute maximus, because they also attach into the hip as well, which is really important to understand, because they're going to stabilize the leg. So here we're starting to build up a bit of a clinical picture with regards to what's happening, because Rupert was telling us that the foot was planted on the ground, not active, and it was stabilizing the leg. So we'd be putting a lot of weight on the fascial structures there as well. So like Rupert was saying, it gave him this burning pain. There's more load on the fascial structures when he's got his leg planted through there, because they're helping to hold everything together. The dynamic structures, so the muscular system is isometrically contracted, so there's no change in the movement there, but it's not concentrically or eccentrically being loaded so much when he's gone to kick. And Rupert, was a very hard kick when you went to do it? No. Yeah, so the forces there that are applied to the body are quite interesting, because it's probably not going to be something of massive amount of force, like a massive rec fem tear or like a hamstring tear or something like that. So yeah, super important to get a good idea of what's going on.
It was incredible. Yeah,
Interesting, right?
I still can't work out how it happened. Absolutely incredible. Obviously, I'm not doing my yoga to the right intensity. Maybe Pilates is for me, Steve.
No, so it's probably interesting enough, when you've got that kind of injury, it's probably not so much the yoga that's the problem. It's probably the fact that you're changing activities quite a bit and your body's not adapting too well. So I'd be looking at your nutrition because of flexibility of the tissues. So making sure you're hydrated, making sure your nutrition's good, making sure your recovery strategy is good. So it's likely that you could have been a little bit too cold going into that kind of exercise. So you've gone from being in the car to walking, then going to kick the ball, which is often the case with that kind of injury, that people are just not adapted to the environment that they're in. So then they go and stress the tissues too aggressively, too quickly, even though it's quite a minor symptom or minor force that went through there. It's something to kind of consider as well. But have you ever injured yourself playing tennis?
So it's the one time, it's ironic because, as coaches, we bang on about wearing tennis shoes. One time I wore running shoes to play tennis. I was about 17, 18. I was just messing about against the wall and I rolled it. Yeah. I'd already weakened that ankle. My right ankle's just had absolute abuse. So, yeah, it's not a happy ankle.
So we have ankle as well while we're there, while we're looking at some tennis injuries.
My ankle's a great case study. It's been run over by a car. It's been crushed by a motorbike. I've fallen off a bicycle and crushed it on there. Tennis twice. Well, actually, no, once, and then football twice. So, yeah. We'll get my ankle on next week.
We'll get your ankle on there now, mate. So this would be...
That is my ankle. Look at that.
Your ankle. Look at that. Skinny as your ankle.
Ligaments on the outside.
Look at those calf muscles there.
What? Can't be me.
This is Rupert here, this side.
It's not me. We're mesomorph. We both know this.
Yeah. So this would be the ankle structure. Sorry, mate?
You got any more of these extra small T-shirts?
Yeah, you might need one, mate. But this would be an ankle area. So this would be it's quite a complex area, and one of the commonly affected areas in an ankle injury is this whole kind of lateral area. So this kind of lateral area is really quite a commonly affected area in lateral ankle sprain, which is what Rupert would have done. So what exactly happened during the injury? Because I know you're saying that you're on the tennis court and that happened.
That one, I just rolled it and I went over the outside. So the my right leg went out. My ankle rolled outwards.
Yeah.
But the worst one was when it got run over because it got crushed by a car between a curb and a car. And I didn't get it sorted because the doctor at A&E told me that it wasn't broken, even though my physio said it was broken. So I didn't get it sorted. Funnily enough, I still get pain. Behind my heel is very, very tender. So even if I just touch it, let alone press it, it's very tender behind there still. And there's a lot of scar tissue around the ankle on the inside, but that was, again, the outside. That was more across the top of the foot where the pain was for like 3 months, 4 months.
Right. And have you had that kind of injury before?
No, I don't make a habit of getting run over, Steve.
Yeah. But you said that with the shoes. You said you'd injured yourself.
I've rolled it again since then. Once playing football, and again playing. Actually, I think it was again playing tennis, but I was in tennis shoes, and I had an ankle support on it. But I had one of those Aircast ones that Murray uses. They're pretty good. I say that I still managed to go over.
Was this after you injured it with the accident then?
Yeah, because it was just always weakened. I mean, my physio at the time said about proprioception and all that sort of side of it. It's always going to be slightly weakened and it's going to affect your balance, things like that. So, and I could feel that I mean, it still does it now. It almost pops and bubble. It feels like there's bubbles there. You can hear and feel it sort of grinding sometimes. It doesn't hurt. It's not painful.
Whereabouts the bubble?
On the bone on the outside of my ankle. There. Right. So just below there, here. But that's where the scar tissue is, either side of my Achilles. So coming down the back of the ankle, my right ankle is like twice the thickness of my left. But yeah, if I press behind, if that's my heel, if I literally just touch it lightly now, I mean, that was 3 years ago and it's still really, really tender. It's very tender. on the
And
bone.
have you had any kind of have you addressed that at all with regards to any physio or scar tissue release or anything like that?
Yes.
Yeah, no.
At the time, I went to my physio. She said, look, she said, definitely broken. Go back. And the guy at A&E told me, he said, it's not broken. Well, you know, it's definitely not broken. So whatever, I won't go
Sorry,
back.
maybe I missed this. Did you get it X-rayed then?
Yeah, an initial X-ray. This was the day after it happened, and he said he said it was too swollen. We couldn't see an X-ray. And at that time, I thought an X-ray was the whole idea was it saw through the swelling, but I was wrong. So he said go back in about 10 days to 2 weeks. But me being me at that age, I didn't.
Yeah. So the problem with having an X-ray too soon after you've got injured is there's a lot of inflammation and debris in the area. So if you've got a very small fracture, if you had a massive fracture, then you'd see it straight away on the X-ray. But the issue is that you've got a lot of debris that's cumulative in the area because of the inflammation. So X-raying someone straight after they've injured themselves isn't that useful unless you think they've got a massive fracture, and then you probably would be X-raying it to stabilize it. But yeah, that's probably why. But just in that particular area in the calf, so let's bring it up here. So in that particular area, you've got some very interesting structures. So where Rupert's putting his finger is just in the back of the tendon there. In the back of the ankle there. So where this sac of fluid just here, that's a bursa. So that sits right on the surface and helps the skin mobilize quite nicely over the top of the tissue. So you don't tear through the skin over the outside. But it's probably more here. Would you say it's more here that you've got the problem, behind the bone, Rupert?
What are you looking at, the blue bit?
Yeah, the blue bit's the bone on the outside of the ankle, so that would stick out of the side. So
yeah,
you should
underneath there.
Yeah.
So the sweat. So I've still got what I'm assuming is scar tissue either side of from the back. So if you look from the back, if you look from behind the foot, either side of what I'm assuming that's my
that's your anatomy. So that's your Achilles tendon.
My anatomy.
That's your Achilles tendon. It's not your anatomy. It is part of your anatomy, but it's your Achilles tendon.
Yeah, exactly. So either side of that on my right foot is twice the thickness, but at the bottom of that, you see where that dark blue bit joins the light blue bit?
Yeah.
About there, maybe a couple of millimeters above. That, if I touch that now...
So this bit here?
Yeah, tiny. Yeah, there and a bit higher. So from there up about an inch, if I press in there, that's very, very tender. I mean, this was 3 years ago. 3 years ago yesterday, the reason I say this is because my friend actually sent me a video of my foot saying this happened 3 years ago today. Like it was a sort of anniversary. Like it's just, I don't know, God knows. And then funnily enough, look what I've done 3 years later. Ironic, eh?
Yeah, odd enough. So it's actually called a bursa. So they can become quite inflamed. So when people have injuries of those, they can normally go through a different stepwise approach to managing it. So initially, if it's very inflamed, they can use anti-inflammatories. They can use ice on the area to help reduce that. And that's normally what you do after a kind of injury like that. But Rupert's case is more of a chronic inflammatory change there. So he's got a lot of debris and scar tissue in the area, a lot of chronic inflammation. So it's a bit too late to be starting to use ice on there because it's not going to have that positive effect. So you really want to try and get a very clear understanding of what was happening and how the tissue was affected by either carrying out an ultrasound scan, so we can have a look inside the area and have a look at what the tissue is and how much debris there is inside there, or an MRI scan, which is in that case is probably a bit more preferable because you can get a very clear idea with regards to other structures that are affected around the ankle. So Rupert, this is quite a common injury in sports in some of the stunt performers that we look after as well. So when they're doing their gymnastics in particular, it's a really common area and a common injury that people can get problems with after that. So it's exactly what the famous people do.
Well, you know me. I like to do my own stunts. Don't need a stunt man.
But yeah, it's super important to get a very clear diagnosis as to what's causing the problem, because the direction that the treatment takes to get to the result is going to be set on the right course by making sure you've got an accurate diagnosis there. So if we were to have a look at Rupert's ankle face-to-face or over the video consultation, we'd be going through a lot more questions with regards to how he did it, what's going on, how he's managing it going forwards as well. But does it give you any problems now playing tennis at all?
For about a year and a half, 2 years, it was definitely weaker, and there was like a shooting pain through my foot if I sprinted, but that was more to do with where I'd crushed the top of the foot. So that was a very acute, fine pain. But after a while, that went after about a year and a half, 2 years, and then the last year I've been fine, raring to go and play some matches, and then then coronavirus comes. So
yeah,
and then this.
So do you with your ankle, do you look after it in terms of doing exercise or rehab or anything like that on it?
The right answer is yes. The real answer is no.
No, just because of time.
Still live? Can I lie and say yes?
Is it just because of the time that you find it difficult to?
Yeah, I think I mean, I didn't have any proper rehab when it happened because I sort of thought, it'd be all right. Because the guy said it wasn't broken, so I sort of took his word for it. I thought, if he's saying that, it's not broken, so I'll crack on. And with sort of soft tissue stuff, and they all say keep it moving. So I thought, Joe, what? I'll go back to work.
Yeah.
But then the physio was saying if it is broken and you've done that, that's a complete wrong thing to be doing. So you might have done more damage, and that's why I'm assuming there is now that scar tissue. And I did have that pain for like 18 months with that really acute like skeletal pain. So I've never broken a bone ever, apart from obviously if this was broken, I don't know. I've done like a ligament in my thumb. I've done ligaments in my ankle. This obviously yesterday, but I've never really, apart from that, I've never touched wood. I've never broken a bone, never broken a leg, an arm, a nose, anything. So I didn't really know what the pain was like. But then when I felt this pain, it was so acute that I thought that surely that is what I was assuming skeletal, to do with my bones, because it was not like nothing I'd felt before with my ligaments or anything. But yeah, I don't know. But no rehab. But maybe I will.
What do you think will happen with it long term if you don't rehab it?
It's going to get worse, Steve.
So what do you think the best thing to do is with it?
Is it going to get worse?
Yeah, it's not going to get best. Sorry?
Arthritis?
Yeah, I mean, arthritis is a consequence of injury to a joint for sure. So not all joints have arthritis in them as a result of injury, but it's quite a high percentage chance that you're going to get some degenerative changes, or it's going to accelerate along that time. So
let's get my rehab started, Steve.
Yeah, I think there's easy things you can do yourself. So even if you were to, like, if you slipped your socks off now, for example, got a little bit of moisturising cream, and then just use it to massage into the back of that Achilles and just try and break out that scar tissue. So the reason why scar tissue is not such a good thing to have there, and the reason why you want to try and reduce it for me, and also hopefully to stop it for me altogether, is because it affects the way the nerves and the muscular system are going to function together. So it's going to give you delayed reaction. So we think it makes you more prone to injury further down the road as well. So not just massively.
That localized area, or in general throughout the body?
Just in general. So it's going to make your tissues a little bit less compliant, less resilient to adapting to forces. So you, from a biomechanical perspective, you really want to try and manage it as best you can. So the body's quite optimal in its current state. So trying to restore it back to that as best as we can is what the therapist's role is there for, really.
Very good, Steve.
Yeah. It's interesting, isn't it?
It's very interesting. Always got some knowledge for me on the body.
Yeah. Yeah, it's important. I mean, you're a tennis player, aren't you? A tennis coach. So
it's the most important thing.
Your body is your tool. So if your tools are broke, then you're not going to be able to be a good workman, are you?
Of course. No, very good. Very good. Get that rehab started. Huh?
No more kit bag.
Funny you should say that.
Excellent. Good. Guys, if you're listening on Facebook and you've got any questions about ankle injuries or knee injuries or quad injuries, then we're here for you. we'd love to be able to help you out, or at least talk through some of those injuries you've had. So please feel free to ask away to Rupert, because he's full of knowledge with regards to injuries like that, of that nature.
He's the man.
Excellent. So Rupert, we've got another session on Friday, haven't we? I'll try and fix my screen.
I feel Friday's always the juicy one. You know, Monday's quite
Just warms
together.
up.
Very factual. It's very factual. And then Friday's just chaos.
What have we got planned on Friday?
This is the problem. I never know, do I? So it's
maybe that's why it's chaos.
It's chaos. It's organised chaos, right?
So on Friday, generally, what we've been doing.
Do you know what, Steve? It's my chance to be chaotic, right? Because we're both so organised normally, aren't we? You know, everything exactly. In Kitbag is like a well-oiled machine, right? So everything, the videos, is also programmed, so you know, set in its ways. So the Friday sort of late show is my chance to, you know, just unwind to the viewers. The three viewers we get each Friday. You know, all of whom are our relatives, right? But we can't tell people that, you know. Unwind and just let it all out. So yeah, no, I can't tell them what we're going to be speaking about yet, but all I can tell them is it will be worth it. And I'll come with my three top tips again.
Whilst we've been live, we've probably had about 25?
25?
25 people. It's a good game.
People who have already watched Killing Eve.
Yes, right at this moment.
Very good. Very good. Well, Friday's going to be a blinder.
So what have we got planned?
I think we're going to go over a shot again. Definitely, we're going to get technical because we've gone over the serve, we've gone over the slice backhand, which was a good one. We've also gone over the volley. I liked that session. We got a bit hands on.
It's good, right? I think it would be great. I'm sure the viewers would love to see this, is to look at some technical aspects about how you would look at progressing someone through from being a complete beginner with playing tennis up to being a little bit more of an advanced beginner. So how would you approach that kind of person? I think that would be really useful for them to know.
Yeah, definitely. So we could take a shot and go through the sort of the stages of learning a specific shot.
Yeah.
Yeah, fantastic. We could even maybe give them. We could even float a bit of the good stuff, bit of the gold dust from Kitbag coaching, couldn't we, Steve?
Yeah, that'd be good. That'd be good to see. You talked about it so much, so it'd definitely be good to see.
I wasn't aware. How many complaints have we had? Why won't this guy shut up?
No complaints. It's good.
I came to watch Stephen.
Lots of hearts and thumbs up.
Yeah, literally.
Yeah,
Friday will be good. Get tuned in. Friday will be good.
Excellent. Good. So yeah, I've enjoyed that tonight. It's been good. A bit of a brain dump with regards to ankle injuries and fascial tears.
Very informative. You know, which is why you're here, because
I haven't even told you what to do. So commonly with fascial tears, you know that burning sensation you get. So most people try and put ice on that, and that's good in the first kind of couple of days or so. But typically, you want to try and not overstretch it. So most people would try and stretch that. It's probably one of the worst things you could do if you've got a fascial tear.
I shouldn't try and stretch it.
You shouldn't be trying to stretch it. No,
okay, I haven't. But I did yesterday. Try and keep it moving. So I was just
definitely keeping it moving is a good idea, but you don't want to overstretch it. So not really locking it in there and stretching it tight, because what basically has happened is you've damaged that fascial structure, and by stretching it, you're going to end up with too much elasticity in the fascia there. It may be that you've torn some scar tissue. There may have been some historic scar tissue there, which is now kind of dislodged and you've damaged it, which isn't such a bad thing because you're helping to remodel it, but you really want to try and get a good understanding of what's happening there. So typically we'd probably put heat on something like that to try and increase the blood flow to help improve the rate of healing in there as well. So it's
that's my deep freeze gone then, that I was pouring all over it last night.
So deep freeze is interesting because deep freeze literally just sits on the surface. So what it does, because it's a chemical sensation in terms of what it does to your skin, it cools down the top layer, which then make your body think it's cooling down. So it pumps more fresh blood into the area. So there's some studies on BioFreeze, which is like a deep freeze cream, which you can put on the surface. It has like a menthol cooling vapor, on there, which cools down the top layer of skin. What you then see is by people measuring the blood flow is a secondary increase in the amount of blood flow in that area, which is
So you're saying it's a good thing to use deep freeze?
Yeah, absolutely. Yeah. But all it's doing is what you wouldn't want to do is... Sorry?
So you're saying it basically it's like artificial, but it actually does do the right thing. It tricks the body into thinking it's too cold, so then it sends blood to the area to warm it up.
Yeah, precisely. Yeah. So that's a good thing to do. But it will have an effect on the pain levels as well because of the menthol and the other things inside the cooling gel.
I didn't take any anti-inflammatories only because I heard, given the current situation, they're not good. But I don't know if that's been proven, so I don't want to have that on record now that we are saying that. You might know more than me, Stephen.
Yeah, as far as I know, anti-inflammatories, if you've got known COVID-19, then it's not a good idea to be taking anti-inflammatories if you've got pain in paracetamol, because it affects the airways.
Okay. Oh, it's the same for asthma sufferers, isn't it?
Yeah, precisely. Yeah.
This is so informative. I've got a headache.
What, sorry?
I said I've got a headache. This is too informative.
What do you mean?
It's too factual. I want the. This isn't what I signed up for. I want the people watching.
Signed up for a lot. We've got to steer it back in the direction that we need to take it in. I think
I'm going to take the helm on Friday. You wait.
Great. I was just wondering if you're watching this online. There's only a few people watching, but I'd love to know if you'd love to see more anatomy because I think it's a really, really good thing to know as much anatomy as you can about the problems that you have. So what I was thinking is that we might tag on some anatomy to each of the sessions so that we can kind of show people what's going on inside their bodies to understand what's going on. But if you'd like to see that, then just give us a couple of hearts as well in the comments box below. We'd love to get you guys interacting a little bit. What do you think? More anatomy?
I mean, I need it, Steve. I need it. Definitely. I like the anatomy. I like maybe not on Friday. I don't want my Friday session being hijacked by serious factual nonsense.
A&P.
I don't want people actually getting some quality from these sessions. That would be ludicrous, right?
Here we go. We've got 2 hearts.
And they're both for you.
Thanks, Mandy. Excellent. We'll definitely do some more anatomy just for you, Mandy. So you better make sure you tune in 8 o'clock, sometimes 9 o'clock every night, depending on whether we're having IT problems or not. Yeah, so I think, the anatomy, I think it's going to go down well. I think, Mandy, I'm not sure if you got it, but we put some images of things up earlier on that you might want to have a look at for Rupert's leg and his foot as well. So we've got inside his leg. And
it did look similar to Ronaldo's leg, but, it was my leg. And we do get mistaken for each other. So.
Malnourished Ronaldo's leg. Excellent. Good stuff. Should we wrap it up there?
Wrap it up and look forward to Friday. I can't wait.
Yeah, good. We need to put up a little summary of what we're going to be talking about on Friday, but definitely some anatomy. So please tune in.
It's usually my 3 top tips, Steve. I think tonight, 3 top tips for you. I think.
Yeah, the 3 top tips. If you get pain from a fascial tear, before you do anything with it, it's a really good idea to understand what's going on with it. If it's a muscular problem, it's going to hurt when you contract the muscle most of the time. If it's a fascial problem, it's going to get worse or feel uncomfortable when you stretch the fascia. If it's a ligament problem, it's also going to be problematic when you stretch it as well. So getting a very clear understanding with regards to what kind of tissue is damaged is going to be super important. So that's tip number 1. Tip number 2 is if you want to increase the it's 8 a.m. PM, Mandy, is the time that we normally start these. So I think you're in Canada, so I think that might be a little bit earlier. Is that right? What time is it in Canada? Okay. Mandy, what time is it where you are right now? And I'll tell you what time it is. But yeah, tip number 2 would be to don't underestimate biofreeze or the cooling gels, but make sure you use them appropriately at the right time, because if you need to reduce the swelling in a particular area. So if you rolled over on your ankle, you damaged your ankle and it's swelled up like a balloon, the last thing you want to do is to put Biofreeze on there thinking it's going to help. It might help a little bit, but you really want to try and reduce the swelling around that as much as possible. Rupert, Mandy says it's 1:45 p.m. So she's, what, 9 hours behind?
1:45 p.m. We're 9:45 p.m. So, yeah, 8 hours, Steve.
Yeah, 8 hours, almost 9 hours. So 8 hours behind. So
she needs to get off there. Well, if we were on
12,
time, bang on midday, really.
Midday, yeah. So Mandy, it's midday.
But if she's there at midday, she's going to be waiting for about 45 minutes minimum. So get up 1:45, Mandy. Have your lunch.
I'll tell you what, we'll message you when we go live, Mandy. We'll set up a message system so you can tune in. But it's literally every single day. So just hover around Facebook around that time and keep your phone by your side, because it's super important stuff we're telling you. But tip number 2, Biofreeze, don't underestimate it. If it's really swollen joint, then you're probably doing the wrong thing putting Biofreeze on it. So try and understand again why the swelling's there, what you can do about it. The swelling's there for a reason, to help protect the joint. So if you then go and reduce the inflammation very quickly and try and get back to doing stuff, it can cause slight issues with regards to further damage to the tissue. So you've got to be careful with that as well. Peter Jones is watching us. Is that for the guy from Dragon's Den?
I knew Peter Jones. You know, he started in Tennis Academy. It was his first big break, mate. I knew he felt threatened by
kickback coaching. That's why he's watching you, mate.
That's the exit strategy, isn't it? That's the year 3 exit strategy.
Peter, stick around.
It can't be him.
We've got a pitch for you.
Even my mum won't watch this show, right? So there's no way there's no way.
I'll take a screenshot afterwards. Peter Jones is online.
If that's Peter Jones, if that's the Peter Jones, we'll send him a free T-shirt. If it's not the Peter Jones, we'll still send you a free T-shirt.
How's he going to tell us? Two hearts? 2 thumbs up. I think Peter Jones, you give us 2 thumbs up. If you're the real Peter Jones, then we'll send you 2 T-shirts. Rupert will anyway. So tip number 3 would be to, like Rupert said, try and stay active with most injuries. There are some injuries where you wouldn't want to stay active. If you fracture your leg, clearly that's not something to be walking around on, because it's going to be super painful and your body's going to tell you that there's a real problem with that. So don't be walking around on it if you think it's fractured. But if you've got minor ligament injuries, if you've got minor fascial tears, minor muscular problems, then the general advice is to try and keep active and keep moving, because that keeps the blood supply up. It also stops the scar tissue from forming too tight, and you get nicely well-organized scar tissue as well. It can really help you in terms of your recovery later on as well. Good. See, that's the quality of the top tips you should be giving people, my friend.
So I zoned out. It's the late show now, isn't it? I was planning for an 8 p.m. start. I've been,
I think I put people to sleep, but
literally.
Hopefully they'll find that useful.
It's just I do know it's good stuff. It's good knowledge, but it's good knowledge.
Okay, and better. I could do the practice. Excellent. Listen,
if you work shifts, then this is great listening, right? Everyone else is
great listening. It's about the mindset and frame of mind that you're in when you listen to it. Just don't take yourself too seriously, I think, is how you should come into the program. And then you should go out of it with a font of knowledge with our massively important, powerfully informative top tips that we always leave you with. Don't you think, Rupert?
Definitely more in depth than mine. Mine is ready position, split step, swing low to high. That's it. It's like that. Done. Yours was very.
I think you've got to up your game a bit. You're playing with big boys now, Rupert.
I'm going to write a script for Friday from start to finish.
Excellent. Look forward to it. We'll look forward to it. Listen, it's been absolutely great seeing you guys out there on Facebook, and we really hope to see you again tomorrow for our evening of power in our power hour. So tomorrow evening is Tuesday night, so we've got the nutritionist and we've got the dental practitioner coming on. So if you'd love to know about what's going on inside you from a nutritional perspective, or if you've got some burning questions about your teeth, then tune in, or teeth or your smell, then tune in and ask Nasan, our resident dental expert, and he'll be happy to answer any questions you might have. Don't forget, it's going to be around 8 to 9 o'clock. So we often do 2 on a Tuesday. So 1 at 8 o'clock and 1 at 9 o'clock if I can get my act together with this IT malarkey. I'll stick to backs and necks and ankles and knees, shall I? Oops.
Well, that's the scary thing. The scary thing is you are so much more IT literate than me. I'll happily say it on here because I'm not even going to try and deny it. Yet you're struggling tonight. So for Friday, we've got no chance.
This is why there's not many other people doing this, because actually, technically, it's quite difficult to connect Zoom and Facebook and all the other bits that you need to be able to make it look pretty much like a second-rate job like we make.
Can't teach punctuality, though, can they?
No, exactly. No one could teach that, mate. You didn't turn up to the meeting this morning, did you?
What meeting?
Hey, there you go, mate. On that note, I'll see you later. Take care, guys.